The work that I've done over the last 3 decades has been centered around personalized medicine. I work in South Africa, in Johannesburg, and I started off my career as a PhD student looking at the genetics of haematological disorders. It was at a time when we didn't understand very much about what caused sickle cell anemia, thalassemias. And I feel that my work over the last decades has been centered on African genetic diversity. Africa is really understudied in the world. Even today, we don't have enough data. But I think from the very beginning, for me, having sort of done a postdoctoral fellowship in London, coming back to Africa and making a difference has been really important. So as part of my career, I set up one of the first DNA diagnostic laboratories in South Africa, where we started doing prenatal diagnosis for sickle cell anemia in 1984, which is almost 40 years ago. So I feel that my work has been adapting. I think I've had an incredible opportunity to live through this time of discovery of not having a human genome to having a human genome that is now so detailed and can be annotated in so many ways that this really will contribute to a personalized medicine. I think not only in Africa but worldwide. Because I think one of the things that are understood is just how variable the genetics is of African populations. And we often talk about African ancestry, but that in itself is more diverse than anything in the world. And so we know solutions that we develop in Southern Africa may not equally apply in West, East, or Northern Africa. So for me in my work, bringing that to the fore has been really important. Global partnerships for personalized medicine are absolutely essential. For one, we need standards because we need a common language. And, the world is now a big village. People are migrating. We see a huge African diaspora in the rest of the world. And we need to work together to make sure that, when somebody is a patient who's seen in one country, that when they move to another, the report can still be read and understood for their benefit and the benefit of their families. So I think, those international collaborations are absolutely critical. I think the work that I see PerMed does is very important. And I really loved the session this morning because I thought it doesn't matter that I come from Africa. I can still understand and be part of this global community. But I think all of us are moving towards understanding that it's all about a system. We need to think in systems. It's not enough to have the research. The research is critical and we need it in many different places. But it's really the systems that make the difference. So we can have wonderful global guidelines. For example, those from the World Health Organization that now has principles about genomic data collection and storage, but it can't be implemented at that level. So implementation has to happen at a national level. So critical to personalized medicine is really a political will or a commitment of governments to actually fund the introduction of personalized medicine. So, I always think that it's not enough to just have the research, although, that is the area that I work. And for me, it's about curiosity, it's about understanding. It's understanding, the contribution that genetics makes to disease susceptibility. But it's not a simple thing, and it's not all about the genetics, because a person is not just the genetics. It's also about their environment. It's about their socioeconomic status. It's about their exposure to infections. And so when we think about personalized medicine, it's important that we consider all of this together. And that is why, for me to watch the multi-omic, multimodal data integration into personalized medicine is really important. And that is going to be the future.